Hey, my name is Kim, and I thought that I would come and talk to you guys about my experience with connective tissue disorder. Disorder. I have been diagnosed now for about 4 months. Originally, I went to the hospital because I was having chest pain, and this was back in May. And then, of course, they ran some tests, told me that, of course, like my EKG and all that was fine. But, I had a lot of pain and inflammation. And so I came back that, I was positive for ANA, which was um, antibodies that basically your immune system produces when you have an autoimmune illness. So, anyways, they told me to follow up with a primary care physician. I did that. And that wasn't until July because I'm going through county, and counties, they got a lot of people that they have to see. But at any rate, I saw Dr. Shanafelt back in July, and so apparently, when you have positive ANA, which is the autoimmune antibodies that your body produces if you have autoimmune illness, then they kind of just, it's like a blanket. Um, they diagnosed you with lupus. So that's what I was told I had in July. But of course, then I was referred to a rheumatologist, and the rheumatologist was able to pinpoint, like run more tests and tell me specifically what I had. So I really don't have lupus. After I went to the rheumatologist that following month in August, she said that lupus was maybe a little bit too extreme. I didn't really show all of, I guess, the symptoms of someone with lupus, but it looked like I had more of a connective tissue disease with the prevalence of scleroderma. Scleroderma is basically, um, of course, an autoimmune disease illness. It's a part of rheumatic diseases, which of course basically impacts your joints, muscles, connective tissue. And then of course, specifically with scleroderma, there's an overproduction of collagen. So your skin gets really, really tight. You lose like the fat and elasticity. And so it just, you get these scaly, patchy rashes on your face, your chest, arms, your lower extremities, your feet, ankles, and whatnot. So from there, originally back in July when I went to go see the primary care physician, they put me on a drug called Plaquenil, which is basically like kind of like the baseline drug for most rheumatic diseases. And rheumatic diseases, for those of you that don't know, essentially are just diseases that affect your joints, muscles, and connective tissue. So that could be, like your muscle tissues, your nerve tissues, and whatnot. And so for me, I didn't know what I didn't know. Um, Looking back on everything, my mom actually, I think I had a genetic predisposition to, I guess, getting an autoimmune illness or a chronic rheumatic illness because my mom passed away back in 2003, and her primary diagnosis was polymyositis. And polymyositis is basically inflammation of your muscles, and that's also a rheumatic disease. And the thing about rheumatic disease is that it's very difficult to pinpoint exactly which one it is. A lot of times you end up, maybe being misdiagnosed, or you may go undiagnosed for a long period of time. I know originally I thought I had arthritis, rheumatoid arthritis, but they can overlap. You could have, a little bit of scleroderma, a little bit of polymyositis, a little bit of lupus. Almost all of the diseases, though, result in a low vitamin D count. You have sun sensitivity, which, looking back on everything and my symptoms that I had earlier, makes sense. And then it was almost like overnight, I lost um, the full range of motion and use of like my shoulders, my arms, and my legs. So I don't want to make this first video too long. I just wanted to get on here and talk about my experience. I feel that in my research and my quest to find out more about the effects that this disease has, especially on Black women, that there is just isn't that much information. You go out and you look, and I don't really see a whole lot of videos or a whole lot of, I guess, maybe just support sites or whatever for women of African American, or I guess African descent. So basically, African American women that have this disease, because it affects us, I think, differently than what it does in maybe our white counterparts. And then also, we have a much higher mortality rate than most other races. Like Black and brown women, we have higher diagnosis of just rheumatic diseases. And then also, we are more prone to, die or, have a more severe diagnosis. So for me, that's serious because, my mom died from a rheumatic disease. And so now I'm 33 and I have a rheumatic disease. And so I'm just trying to figure out, like, well, what do I do? How do I live with this? What types of medicines, should I take? Do I just go with everything that my rheumatologist, my dermatologist, and my primary care physician, and my pulmonologist, and the cardiologist? Because you have to see all these doctors, because the disease basically, systemically attacks your system. And essentially, that's what autoimmune illnesses do. They kind of systematically break down your system, and your immune system just goes haywire, and eventually, you die. So I don't want to die from this. I want to beat this, because I wholeheartedly believe that these diseases, there's a way for them to be reversed. Obviously, go into remission and even potentially be healed from them. Now, of course, that does mean that you would have to maybe do some more holistic therapy or holistic alternatives, health and wellness, dietary changes. And so I'm going to talk about all of the different things that I have done over the course of these few months and even last year, thinking back, because the first thing that I noticed that was changing about me last year was skin depigmentation. So of course, doing research, I kind of self-diagnosed myself with vitiligo, and then upon following up with a dermatologist, they confirmed that in fact I did have vitiligo. Well, now, a whole year later, I realize that it's not necessarily vitiligo, but it is just a symptom of scleroderma, which is either, hyper or hypopigmentation, which either means, of course, you have dark patches or lighter patches, in your skin. So that's uh, very interesting. I'm actually happy to talk about that as well. And so I'll just come back on here and I'll start talking about my journey and the things that I found that were helpful. Nothing that I say or I want anyone to take it like it's medical advice. Obviously, if you have a rheumatic illness, you need to most definitely follow the orders of your doctor. But just keep an open mind and think about, well, maybe my diet can help reduce inflammation, or maybe it'll help me, improve my range of motion. Maybe I should think about exercising. And hopefully, we can talk about this openly and maybe even create like a support system for women, specifically women of color who are dealing with these types of issues. So I look forward to speaking and meeting all of you guys. And I don't think I told you guys my name, but my name is Kimberly. I'm in Texas, and I have scleroderma, and I am just looking to start a community that is supportive and encouraging for women who are trying to deal with this issue and this disease daily. Okay, so until next time, you guys have a great evening. Bye bye.